program that allows less experienced mental health nurses to be paired up with more experienced mental health nurses to spend a week in the different services.
I was approached by our Director of Nursing to be involved, although I had seen the program advertised the year before.
It was one of the clinical operations manager who came to me and said, you know, Mel, you should take this as an opportunity, apply and see where it will take you.
I basically rang up, put my name forward very early on in the piece, wanting to be part of this idea.
I got involved with it when I was working at Bloomfield Hospital in Orange. I used to work with Bob Fenwick himself, so when I saw the name on the expression of interest, that sparked my interest.
And when the program was established, I thought this is a great way to honour a fellow psych nurse.
It's been a fantastic opportunity to participate in such a great program. First and foremost, I think the partnership between Rui, my mentor, and I was a perfect match.
I organised the week so that she was able to experience different areas of special mental health services for older people on the northern beaches.
I was paired up with Duncan Howard, who works at Sutherland Hospital. He was working in the team leaders position at that stage.
I was linked up with a young guy from the Lismore area, and I was able to basically show him around our facility, which was a large metropolitan area. And with the 30 odd years experience in mental health that I had, pass on some of the knowledges and experiences that I had.
I was petrified, absolutely petrified. It was my very, very first time going away by myself, and particularly in a plane by myself.
What I wanted overall was to offer Kayleen the opportunity to come down to have a rich experience, open up a whole lot of things for her to take back and then to integrate what she wanted into her own clinical life.
It was refreshing just being in a different environment and being sticking closely with someone with more experience.
And just to see Rui, you know, in day-to-day activity, I just was blown away, and so thankful that I had that opportunity to see that for myself.
He worked alongside of me most days, and I was able to link up a visit to our PEC unit, a visit to our child and adolescent ward, a visit to our community mental health facility. I was able to organise for him to go across and experience and follow patients through ECT procedures, links with the magistrate when they visited. So of an afternoon he was often off doing these little things that perhaps he may not have seen in the country areas.
I felt like I was definitely an observer to my own workload here, with all the clinical and operational demands and everyone wanting a piece of you and not enough of you to go around.
I drew people from from Mental Health, Drug and Alcohol North Sydney together for a research session to offer her the opportunity to talk to people about how you can work as a nurse and enhance your practice through research.
I think sometimes when you're a new grad, sometimes the culture of the workplace can be negative, and I was starting to feel that way, and it came at the perfect time for me because spending a week with Duncan, it was refreshing, and seeing how he was quite, he was very calm and patient with people, and I'm talking about colleagues as well.
Definitely going into a new environment and setting with fresh eyes and the openness to learn new skills and new professional ideas on how to achieve the same outcome, which is basically to provide the highest level of safe and client-centred care.
I feel that knowledge, I suppose, is a two-way street, and we learnt as much from him as a collective in our ward as I think he took away from our ward.
So I definitely think that's improved in terms of my time management, my prioritising skills, and my overall satisfaction of my role as well. I feel a lot more satisfied and more confident.
And strengthen ourselves and become more resilient in a really complex workplace.
It's very important for especially new grads to find someone that is more experienced, that has a positive outlook on mental health.
You know, I think it's great. I think people should do it.
Absolutely, I found it an experience, and if I was still working in that facility today, I would have done it again this year as well.
I think that this legacy that comes from Bob Fenwick is an exceptionally important aspect, educationally and experientially, and it's a bond between people.
Fantastic. I don't, like, looking and reflecting upon the week that I had, I don't think I would have ever had the opportunity to do it if it wasn't for the program. So yeah, it was really brilliant. It was great.